We'll do it quite detailed and slow the first time, yeah? Ready to start? Yeah?
Yep.
The lung channel starts once and inferior to the hollow of the deltopectoral triangle. It travels down the lateral border of biceps brachii, across the transverse cubital crease, down the flexor aspect of the forearm, through the wrist joint, across the thenar eminence to terminate at the radial nail point of the thumb. The large intestine channel starts at the radial nail point of the index finger, travels up the radial aspect of the hand, through the anatomical snuff box, the radial aspect of the arm, the lateral aspect of the transverse cubital crease, up through the anterolateral aspect of the shoulder, across the trapezius, across the sternocleidomastoid, crosses the face below the nose to terminate in the nasolabial groove on the other side of the face. We have the lung channel on the other side, starting once and inferior to the hollow of the deltopectoral triangle. It travels down the lateral border of biceps brachii, across the transverse cubital crease, down the flexor aspect of the forearm, across the wrist, across the thenar eminence to end on the radial nail point of the thumb. The large intestine channel starts on the radial nail point of the index finger, travels out the radial aspect of the hand, through the anatomical snuff box, up the radial aspect of the arm, through the radial end of the transverse cubital crease, and ascends through the anterolateral aspect of the shoulder, across the trapezius, crosses the sternocleidomastoid, crosses the face below the nose to terminate in the nasolabial groove on the other side of the face. The stomach channel starts inferior to the orbital margin. It swoops round the jaw, anterior to the ear, and up onto the corner of the head as if you were going to grow horns. A further branch separates from the jaw, comes down lateral to the thyroid cartilage, moves out to the midpoint of the clavicle, descends through the nipple in the male, through the rib cage. When you get to the abdomen, it moves close to the centre. It descends to the pubic bone, where it then moves out the anterolateral aspect of the leg, all the way down to the lateral nail point of the second toe. The spleen channel starts at the medial nail point of the big toe and ascends just posterior to the medial crest of the tibia. On the abdomen, it's on the lateral border of rectus abdominis, this big muscle of the stomach. It then moves to the side to terminate in the 7th intercostal space below the apex of the axilla. From here, we move on to the heart, which starts at the apex of the axilla, travels down the medial border of biceps brachii, down the forearm, through the wrist, across the palm, to terminate on the radial nail point of the little finger. The small intestine channel starts on the ulnar nail point of the little finger, travels up the ulnar aspect of the hand and arm, comes up the back of the arm, sweeps across the top of the shoulder, comes in between the sternocleidomastoid and the angle of the mandible, onto the face, below the zygomatic arch, inferior to the outer canthus of the eye, and zigzags back to the ear, anterior to the tragus. So the heart channel again comes down the medial border of biceps brachii, down the forearm, across the wrist, across the palm, to the radial nail point of the little finger. The small intestine channel starts at the ulnar nail point of the little finger, travels along the ulnar aspect of the hand and arm, up the back of the arm, sweeps across the top of the shoulder, comes in between the sternocleidomastoid and the angle of the mandible, comes onto the cheek below the outer canthus and inferior to the zygomatic arch, and zigzags back to the ear, just anterior to the midpoint of the tragus. The bladder channel starts just medial and superior to the inner canthus. There are 2 lines over the top of the head and neck. Then there are 2 lines down either side of the back. It zigzags through the sacrum, goes down the posterior midline of the leg to terminate at the lateral nail point of the little toe. From here we turn the sole of the foot up to sweep the sole of the foot, the most medial aspect of leg and thigh, very close to the anterior midline on the abdomen. When we get to the rib cage, we come out and ascend to terminate at the lower border of the clavicle. Pericardium channel starts 1 cun lateral to the nipple in a male. It descends through the 2 heads of biceps brachii, down the forearm, across the largum on the palm, to the tip of the middle finger. The Sanjiao channel starts at the ulnar point of the 4th finger, ascends the dorsum of the hand, dorsum of the arm, the posterolateral aspect of the shoulder, across the sternocleidomastoid, across the trapezius, up the back of the sternocleidomastoid, pads around behind the ear to terminate on the lateral aspect of the eyebrow. Pericardium channel starts 1 cun lateral to nipple in a male, goes through the 2 heads of biceps brachii, down the forearm, across the largum on the palm, to the tip of the middle finger. The Sanjiao channel starts on the ulnar point of the 4th finger, ascends the dorsum of the hand and arm, goes through the posterolateral aspect of the shoulder, across the trapezius, up the back border of the sternocleidomastoid, pads around behind the ear to terminate on the lateral aspect of the eyebrow. The gallbladder channel starts lateral to the outer canthus, goes zigzags across the side of the head, across the trapezius, all the way down the side of the body to terminate at the lateral nail point of the 4th toe. The liver channel starts at the lateral nail point of the big toe, crosses the dorsum of the foot, very close to the medial crest of the tibia, and terminates in the 6th intercostal space below the nipple. The chi then goes up again to lung 1 and the circuit continues.